The title of today's presentation is Bone Marrow Derived Stem Cell Therapy. It's sponsored by Apex Biologics and their XL bone marrow concentration technology. So today we have Dr. Atlery and Dr. Richard Rosenthal discussing biologics derived from bone marrow aspirate. So Dr. Rosenthal is a board certified physician in anesthesiology and pain medicine, addiction medicine, interventional pain management, certified in regenerative medicine. He's a director of Apex Biologics and the Advanced Regenerative Medicine Institute. He's also an examiner for the regenerative medicine certification offered by ACIP and has published multiple peer-reviewed journal articles and medical textbook chapters. Dr. Atlery is a board certified anesthesiologist in pain management. He is named one of the top interventional pain physicians by Becker's Review, and he's one of the few in the country to perform intradiscal and subchondral stem cell therapies. He's also the co-editor of the largest textbook written about stem cells and pain management, and he's also the co-author of Regenerative Medicine Guidelines put forth by ACIP. So gentlemen, thank you for being with us here today. We're very pleased to have you here and look forward to your presentation.
Objectives. So we're going to talk about bone marrow and the science behind the use of bone marrow for regenerative medicine and the technique to aspirate it in order to get the maximum number of mesenchymal stem cells and get the best possible outcome. I'd like to acknowledge Dr. Philippe Ernagout for developing this technique, as well as Dr. Atlery for his research on bone marrow concentrate. And then I use some slides from Dr. Chris Centeno that you can see yourself on YouTube, and also Matt Murphy for his help and research in this field. Okay, so let's just start by talking about, by defining what is bone marrow concentrate. And bone marrow concentrate is a complex solution of cells, growth factors, cytokines, and other substances that work together to promote healing. I think the important thing here is to realize that we're not just talking about mesenchymal stem cells, but in fact, we're talking about an amalgam of various anabolic substances and anti-inflammatory substances working together to produce the response that we're looking for. Inside bone marrow, there, as I said, are a variety of different substances. So for example, in the Buffy coat, there are the MSCs, but there are also hematopoietic stem cells, as well as platelets and T and B cells and white cells. Within the platelet poor plasma, there are matrix building proteins, there are cytokines and anti-inflammatory as well as anti-enzymatic proteins. So in other words, the effects of bone marrow are not necessarily dependent on MSCs alone. Instead, bone marrow contains, as I said, an amalgam of various anti-inflammatory and anabolic substances that work together to produce the final result. However, it is important to realize that MSCs do play an important role. And this next slide, although it's somewhat busy, if you look at the study, the second one down from the top on tibial healing of tibial non-union fractures. This is a study by Dr. Ernagout. And what they showed was essentially that there was a minimum number of MSCs. And if you were below that number, you did not get healing. So if you look under clinical outcome, bone union achieved in all 53 patients who had an MSC count above 1,500 MSCs per cc. But those that had 630 MSCs, those patients did not, their fracture did not heal. So essentially what that's saying is that there's a minimum number that's necessary. And essentially that's what this talk is about, how to improve the number of MSCs in the aspirate in order to get the highest number of MSCs in the final product called the bone marrow concentrate. So I like to start at the beginning, and pardon me if this is somewhat too basic, but I think it's a good way to get everybody on the same page. So inside of bone marrow, there are two types of cells. There are blood cells, of course, in various stages of development, and there are stem cells. There are two types of stem cells. There's hematopoietic stem cells and mesenchymal stem cells. And if you look, the concentration of HSCs, or hematopoietic stem cells, is much, much higher. For example, in the bone marrow, one cell in 10,000 to 15,000 is an HSC, whereas MSCs, the concentration is significantly lower. One in 250,000 cells in the bone marrow is an MSC, and that number declines with age. That's the reason why the technique that we use in order to acquire these cells is different than the technique that might be used by a hematologist. Because essentially a hematologist can just aspirate the cells, and he's going to get a significantly high number of hematopoietic stem cells. But for us, the number of MSCs is so low that we need a specialized technique that we're going to discuss. I'm just going to discuss quickly the importance of the system that you're using, because the system can make a big difference in the outcome. Commercial systems recover anywhere from 20 to 90% of MSCs. So depending upon the system that you're using, you're going to get a significantly higher or lower concentration. Now, I use the Apex system because I find it to be flexible. When I use it, you can, so for example, with PRP, you can get a very clear solution, or for example, if you're injecting a joint, or you can get a solution containing more red cells and white cells, for example, if you're injecting a tendon or a ligament. The system is one of the lesser expensive systems on the market, and yet it concentrates platelets. Now, this is talking about platelets, not bone marrow, but it concentrates platelets somewhere between 7 and 10 times that of the baseline. So it's an excellent system. It's easy to use. It's easy to train your staff. And because of this stand that you place, that you use, it makes obtaining the Buffy coat easier.